This is Dr. Klein coming to you from Raleigh, North Carolina. We're on part 2 of our talk about the PDMP and Apres, which I spelled wrong. This is a private company. So we've had talks before about the PDMP, which is the Prescription Monitoring Drug Program. 10 years ago, when they had these criminal pill mills in Florida, patients would go around with fake x-rays from doctor to doctor to doctor, and they could go to 5 or 6 doctors in the same day, go down to the pharmacy and fill 6 prescriptions over the next few days, or go around to different pharmacies. They're pretty smart. I mean, they were making a lot of money. So what was needed was some kind of central program to monitor these folks that were going to different pharmacies, and they started the PDMP at Brandeis University under a $14 million grant from the Department of Justice / DEA in order to help doctors find out about their patients. That's not the real reason. Why would the Department of Justice and the DEA want to help doctors in their medical practice? Medical practice is not part of federal law. All medical practice is state-driven. Keep that in mind. So they got this PDMP going, and then the states had to sign into it, but the states had to come up with their own software. And it was done by a company called Apres. Apres is a private for-profit company who, behind the scenes, in secret, came up with algorithms, that's checklists, to determine whether or not people would overdose. And here is one of their reports. You see that? 560 is the score. So then this ends up in all the medical records. They now are accessing people's medical records. Whoa. Oh, we're getting out of hand here. And this basically gives you a risk of whether or not the person is going to overdose. Well, wait a minute. We know that overdoses only occur in people with heroin addiction disease, 95%, and all of them are multiple drugs. So if you die with 5 drugs in your system, there is nobody in this world that can tell you which drug it was. When people with heroin addiction disease or mu receptor disease die and they take a blood level of heroin, it's less than the blood levels in heroin addicts at clinics. Whoa, what's going on here? What's going on is it's an interaction between multiple drugs. We are researching this, but it appears there are almost no overdose deaths from heroin alone unless it's injected too rapidly. It's very small. It's all 95% is multiple drug overdose. So how can you come up with this number? What Apres has done, it used the Ohio information, which we are studying, and they took the Ohio overdose numbers. Ohio is no different than the US. The people who are dying are heroin addicts, dying without medical care and being chalked up as overdose deaths, which they are. So Apres, the company making millions and millions of dollars selling these programs to feckless legislators. Feckless means you're an idiot, uninformed. So you can't really develop an overdose risk score for people who are not heroin addicts. So what Apres has done is they've developed a risk score for heroin addicts on the streets who are not getting medical care. And it got nothing to do with people getting prescription drugs from doctors like me, or previously like me. This doesn't apply. And do you know that states are paying millions of dollars for these phony overdose scores? Now, is this a problem? Yeah, guess what? Pharmacists are denying people their medications because, oh no, they have a high overdose risk score, and I'm not going to be responsible when they overdose because here it is. So now the pharmacist becomes liable. So the pharmacist has this report, whether they want them or not, because the state legislature mandated it and paid $1.5 million a year for it. So there it is in the pharmacist's records. How could the pharmacist possibly take the risk and supply the patient with pain medicines? So slowly, people with pain medicines, 10 million, who need them for their permanent, rare, painful diseases, are being assassinated. Now, I don't use that word lightly. This is an assassination. To come up with a phony score for people that this was not normed on, that were heroin addicts, is assassination of people with painful disease. And I can tell you from the 34 people that I took care of who were denied care by more than 10 doctors, who had serious permanent painful disease, that their lives were wrecked by not having appropriate treatment. So would a person with cardiac disease, if they didn't have their cardiac pain regimen, a person with high blood pressure, a person with pulmonary disease, all of these people need their pain medicines as prescribed by us doctors. But here we have a private company selling dishonest information to feckless legislators who are running around going, oh no, what can we do? We have to do something. People are calling us up. They're saying my son overdosed. And so get rid of the doctors. Don't let them run around prescribing. It's called mass hysteria. And you can read about it. It's a real thing. And it occurs, it's a sociological phenomenon. It occurs when people pass frightening information back and forth. This happened during the Joe McCarthy times when he accused General George Marshall of being a communist. And it went on for multiple years, ruined people's lives, not to the extent that a life is ruined when you take away their pain medicine. I have a case to report of somebody who I saw 3 years ago who had his back injured in a parachute jump in the Air Force because he was training to work for the intelligence service. His back broke. He got operated on by an Air Force surgeon. Following the surgery, his pain was worse and continued to be worse, and nobody would give him any pain medicine. Not the surgeon who botched the surgery, not people in pain medicine, not people who are in daily practice, because if you give somebody pain medicine, they'll turn into dope fiends and come and kill us. That's what the fear is. So he struggled for years, went on Medicaid, trying to raise 2 kids, married, wife had little part-time jobs. His boys were in a band, a marching band, as was he. He had researched suicide and found out the best way to do it was with tanks of nitrogen, and he bought them. 2 weeks before he came to see me, driving more than 10 hours from a distant state, he was about ready to do it. This is a man with 2 children and a wife. This is how serious it is for a person to suffer every single minute of every day We just started him on some pain medicine. The big, heavy guy needed a high dose. Turned his life around. He was able to get a job, went off Medicaid. Then he started having trouble with the pharmacies. Guess what? His pharmacy, his mail order pharmacy, Express Scripts, decided unilaterally to cut him off. Didn't call his doctor, took the illegal action of ending a prescription, which pharmacists cannot do unless they have a medical license, and are slowly tapering him off. He finally got down to a point that he could not perform his job, and with tears, both in his boss and himself, he had to let them fire him. He's now struggling with no medicines the way he was when I first saw him. He's got a son in college. This man has been assassinated. I don't know if they were looking at narc scores. Probably they were. This all goes on behind the scenes. The pharmacy, Express Scripts, illegally practiced medicine by taking this man off his medications. This is the worst tragedy in the history of this country. He was taken off without consent. He was forced off pain medicines that allowed him to work, generate income for his family. Now he's back on Medicaid and will probably be applying for disability. Well, that's enough for today. We're going to work on this problem with Apres at our National Pain Council, our new group that I mentioned before. It's very young, and we need volunteers, and we need donations. You can go to our new website and understand it's new, and it's www.nationalpaincouncil, all one word. Council is COUNCIL.org. We are not going to give up, and we are not going to let people like this man be assassinated by the government and by Express Scripts. Thank you.